You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you are considering dental implants. If you are missing one tooth or all of your teeth, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Marty Burtner. Dr. Burtner is the founder and owner of Carolina Oral and Maxillofacial Surgery. We've invited him on the program today to discuss who's a candidate for dental implants. Dr. Burtner, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, you're an oral surgeon. Oral and maxillo, am I saying it right? Maxillofacial surgeon.
Yes, correct.
What is that? Tell me about the training involved there.
Well, to become an oral surgeon, you have to become a dentist first. And basically, after becoming a dentist, then you go on to advanced training to become a dental specialist like an oral surgeon.
So moving on to today's topic. Who's a candidate for dental implants, what you need to know. What kind of patients are you seeing that are getting dental implants?
Randy, I see patients of all ages. You know, as far as how old can you be for a dental implant?
Yeah, how old
what's the maximum age? There's really no limit. What
are some of the older patients?
Probably the oldest patient that I've placed implants on has been late 70s, early 80s.
Okay. Why would somebody that age, 80 years old, even though it's young today?
You'd be surprised. I mean, I see a lot of, and most of those patients are women, and they come in because maybe their spouse is now deceased, and they have friends and folks that they'll go out with, and they're looking to establish new relationships, and they don't want to walk around missing teeth, and whereas before with their spouse they were very comfortable wearing dentures or whatever, and now it becomes a very uncomfortable thing because they're becoming a little more socialized. They're interacting with other people and trying to in some cases get back in the dating scene.
Now, one of the things you said is that for implants, dental implants, you could secure a denture. Is that right? Yes.
Actually, you don't even need 4 implants. You can do as few as 2. And a lot of the restorative docs that I work with, they would prefer to have 2 implants.
Is that right?
Well, yes.
Because, going into this, I think, you count your teeth, and I'm thinking that's a lot of dental implants.
Right.
For the denture wear, but that's not the case.
No. Most patients, when they have dentures, the lower denture is always the most problematic. And for the lower denture, 2 implants can be very, very beneficial. It can help stabilize that denture tremendously. And most people, that's the most frustrating part.
You say people compromise their diets, like the denture wear.
Absolutely.
Elaborate on that.
Well, you'll hear patients come in and they'll say, well, I haven't been able to eat an apple, or I can't bite on corn on the cob and things like that. Those are the types of patients that in fact, when they've been wearing dentures for a long time, they just forget about those foods because they can't eat them, and they'll have to just cut them up and things like that. They can't just eat an apple like you and I would.
Okay. What are the different categories of dental implant patients you see?
Randy, I see all sorts of patients. I see the traditional one tooth that's lost. The patient is looking for just a single implant. You see the patients that they've had a bridge for a very long time, and now one of the teeth has failed, and the bridge is going to have to be removed. They've got to go into a partial. And then there's the folks that they've had all of their teeth, and now for some reason, due to decay or periodontal disease, they're going to lose their teeth, and their dentist has basically condemned the teeth, and they can't accept the fact that they've got to go into a denture.
So they have to make a decision between a denture and dental implant.
Right.
Okay.
And then you have the patient that's been wearing dentures for many years, and they get to the point where they've lost bone, the dentures don't fit anymore, they become very frustrated, and they're looking for something to make their denture experience easier and able to live a normal life and eat a normal diet.
My mother, anticipating this interview, talked to her about this, and she's 73. She's been wearing dentures since she was 28. She says, Randy, I told her, because on the phone you say that 70 is not, is a candidate, and she says, I'm too old for dental implants. Is that a common thing you hear, or a perception out there that?
Not really. I mean, as far as age goes, I really don't have patients coming in and saying, am I too old for dental implants? they don't want to accept to them, they're not old. They're ready. They're going to live forever. They want dental implants. They don't want to compromise anything. But in your mother's situation, what has happened is when you're missing your teeth and you're wearing dentures for a long time, you tend to start losing bone and you lose that denture support, and they become very frustrated.
So if she's been in dentures that long, do you think she could still be a candidate?
Absolutely. Yeah, because in a lot of cases, there's still adequate bone to be able to place enough dental implants to give her some support. And if there isn't, then you can do things like bone grafting and things like that to build up enough bone for the dental implants.
So backing up to the one tooth.
Yes.
Why would somebody with just one tooth want to go with a dental implant as opposed to traditional dentistry?
Right. And as you can imagine, most patients that lose one tooth, they're probably some of the younger patients. And this is the start of something that they see as very dramatic. Oh my gosh, I've lost a tooth. What am I going to do? Well, their options are basically you're either going to wear a one-tooth partial, which is a very cumbersome thing for most people, and young people aren't going to accept that. Or do a bridge. And with a bridge, you basically have to compromise two teeth.
What do you mean compromise?
You've got to prep the two adjacent teeth, which means you're going to cut the two adjacent teeth down so that they can accompany a crown that's actually attached to a prosthetic tooth in the middle.
So a dental implant, is definitely the better way to go?
Well, yes, absolutely.
In
fact, in a lot of cases, dental implants have become the standard of care. And a lot of people can actually get themselves in a pinch if they don't actually give the patient that option. And a good example would be a young patient comes in, they were involved in a traffic accident or a sporting accident, bicycle, whatever, they lose a front tooth. They have no fillings in any of the front teeth. They come into the dentist, and the dentist doesn't give them that option for a dental implant. That's not good.
Do you hear that, by the way? They say, "How come never?" I was
Occasionally, I think it's getting better.
So nationwide,
I think it's getting better. A lot of dentists are becoming more in tune to dental implants now. The nice thing is, for a patient like that, they can maintain the two adjacent teeth. And the dental implant is a self-functioning dental prosthetic device.
How important is it, by the way? Because you say that there's the surgeon that places, and then there's the person that puts the tooth cap on it. And we talked to and you say you should look for a surgeon, an oral surgeon. Why is this so important? Because there are general dentists that are doing both.
Right.
So tell us about that.
I think that in most cases,
you think, hey, they should go to an oral maxillofacial guy?
Well, I do, of course, because I am an oral surgeon, but I think that when you have someone that's trying to do everything, it's hard to be good at everything. And when you talk about someone that restores dental implants, because
what does that mean, restore?
Restore means building a tooth on top of the implant. The implant is basically a screw that's made out of titanium that goes down in the bone, and
it seems pretty straightforward, though, by the way, putting in a dental implant.
Yeah, when you look at it, the basics, you could train anybody to screw in a dental implant in the bone. It's, a great analogy is you can drill a hole in a piece of wood and put a screw in. When you look at it from that standpoint, it's not much different. But where implants become very critical is the way that the teeth function together, the way they fit together. The implant has to be in the perfect position. If you get a bad dental implant placement, then the whole case is shot.
Is that right? Does that
Absolutely.
happen?
It does. It does.
And I've had back in your lap?
I've had patients come in where they've gone and they've had dental implants placed elsewhere, and the implant has either failed or it has...
What does that mean, failed?
Fail means you lose the implant. You lose the screw. It doesn't fall out, but you end up losing bone around the implant and you start having problems. If the implant is not placed correctly or restored correctly, then you can run into those problems. And that's why I think it's important to, implants should be a team effort. And usually it is.
With the general dentist, you say?
Absolutely. You've got to have a restorative dentist, and you've got to have a surgeon. The surgeon is the person that's going to actually do the surgery to place the implant, and they're usually going to work hand in hand with the restorative dentist. A lot of times the restorative dentist...
When you say restorative dentist, they're the one putting the tooth...
They're the one building the tooth. The restorative dentist is the general dentist that's going to be building the tooth. A lot of times they'll work hand in hand with the oral surgeon from the standpoint that they'll even make a model of what they want that final tooth to look like, and you have to go by that and place the implant so that he can indeed reproduce that. A lot of the general dentists that are out there placing their own dental implants, you know, a lot of them are very, very good at it because they've been doing it a long time. But, you know, I think that when you have kind of a team effort going on, I think that you get an overall better.
It seems like a very painful procedure.
You would think so. I mean, when people think about cutting off bone, drilling a hole in the bone, you know, patients always kind of cringe when you tell them that you're going to drill a hole in the bone and place this screw down in the bone.
Do they complain about pain?
They don't. It's amazing.
Is that right?
It's really amazing how you can, in fact, most of my patients are patients that will come in, the general dentist has referred the patient to me to extract a tooth, and then we go on to discuss what we're going to do to replace the tooth. So a lot of my patients are repeat patients where they come back to have the implant placed after we've done the surgery to remove the tooth. And most of those patients, they'll actually state that it's actually less painful than when they had the tooth extracted, both during surgery and after.
The bone doesn't have feeling.
No, the bone has a lot. The bone has a lot of nerve innervation. It has a lot of feeling. Absolutely, you cannot just take non-anesthetized bone and drill a hole in it. The patient's not going to like you too much. But the other thing that oral surgeons can do that most general dentists and other dental professionals that are placing implants is their own anesthesia. We're able to put patients to sleep in the office.
Oh, is that right? You do that?
We do. Oral surgeons are trained to do anesthesia. A major part of the training of an oral surgeon is anesthesia based. And we put patients to sleep in the office by IV sedation, and we do the surgery.
They're out
place the implants. They're out. They wake up. They're done. They know nothing that happened. They get up 20 minutes after the procedure, and they go have an x-ray taken, and you know, they recover how much ever longer it takes, and they walk out of the office.
How does somebody get to see a specialist like you? Do they check with their general dentist? Can they call you directly?
They can, absolutely. I have probably 50% of my patients just find me in the yellow pages. They'll look for an oral surgeon. Most patients associate getting a tooth extracted with an oral surgeon. It's funny, most general dentists are trending towards not doing a lot of surgical type procedures because they want to spend more time on the restorative side. They want to be able to spend a lot of time with the patient when they're restoring teeth and doing the aesthetics, doing the fillings or doing the crowns or the restorations for the implants and things like that. So I probably see a lot of patients that just find me, and then I will in turn ask them, you know, who's your general dentist? Does your general dentist know that you're here today? And if they don't, then we always send a letter to the general dentist to let them know what we're doing. And then if we get into things like dental implants and they don't have a general dentist, then I will give them, you know, several options of general dentists that will restore the implant if that's where they want to go. So we always kind of, it's hard to be an oral surgeon and just treat the patient yourself. You typically have to have a general dentist or you know, someone that you can refer the patient to for general dental care and things like that.
Okay, now for the denture wear, moving on there, what's the big advantage
with dental implants and wearing dentures? Dentures are probably one of the most frustrating parts of dentistry for both the patient and the dentist. You know, I have a lot of general dentists that they'll joke and say, you know, when I do a complete denture case, I charge double for the upper denture. I give you the lower one for free because they know that most patients are going to absolutely hate the lower denture.
Are all denture wearers? I mean, I know a few people that have dentures. And they don't seem to complain about them. But for the most part, are they all somewhat unhappy with their denture?
I'd say probably 75 to 80% of denture wearers are unhappy. At some point, they may be happy initially because they have plenty of bone, the denture fits well, but now that's usually the upper denture. Most patients that have been wearing dentures for a long time, they typically don't wear the lower denture. I see a lot of those patients.
You say they forget what it was like to chew.
They do because with dentures, you know, the upper denture most people tolerate okay and they're able to chew with that. It's the lower denture that causes the most problems. You've got the lower jaw moving, the tongue, everything, and when they're eating, sometimes it's tough to keep that lower denture positioned so they can chew effectively.
So 2 dental implants and they get something that snaps in, snaps out.
Yep, actually 2 dental implants, and they have a device, restoration on top of the implant that actually snaps onto the base of the denture. And then
Is that strong enough to eat like corn?
Oh, absolutely. Most patients are very, very happy, especially if they've been wearing dentures for a long time, and they're used to fighting that lower denture. They then come and get 2 implants, and they're just blown away.
You say that for the lower denture wear, if there was a try-in period,
right,
that they could never go back.
No, if you took a patient that's been wearing a lower denture and you place 2 implants,
and they think they're fine,
and then they have the absolutely they've been doing fine with the lower denture. You take that same patient, you place 2 implants and restore it such that it snaps onto the lower denture, or actually the lower denture snaps onto the implants. They'll never go back.
Okay, now the upper plate, is it because, by the way, backing up, is it because they could eat again? I mean, it's just the bite force?
It's just, no, it's not necessarily because of the biting force. It's the biting, when you place like a sandwich or an apple,
okay.
when you place that and you bite into it, the typical thing that's going to happen with the lower denture is it's going to pop up in the back.
A little bit, okay.
And it becomes very unstable, and patients are just very uncomfortable with that. The dental implants are going to help stabilize the denture.
What about the upper? What's the big advance there?
The upper denture, even though patients, in most cases can tolerate an upper denture, their biggest complaint is they don't like having something covering the entire roof of their mouth. They don't like that. I have a lady right now who she came to me because her general dentist told her that she needed to lose the remaining teeth in the upper jaw, and she was going to have to go into a denture. And he initially made her a partial and actually covered the entire roof of the mouth with the acrylic material, and she has a horrible gag reflex and just cannot tolerate having that on the roof of her mouth.
So how many implants do you need for the upper?
Well, same as the lower. You could either do 2 and have it support a denture, or you could even go 4 implants in the upper jaw, and you could actually make a fixed prosthesis that actually bolts onto the implants.
So 4, and you get something that stays. You get your teeth back.
Absolutely.
But it seems like everybody would want something fixed,
right?
That they don't have to take in and out.
Most people do want that, and in a lot of cases it becomes a discussion of economics. You know, what can the patient afford? But what's so funny, Randy, is when you look at the grand scheme of things, the amount of money that patients spend on root canals, crowns, and bridges, and things like that, it becomes actually the same or even cheaper with dental implants in some cases.
We're going to take a quick break. We come back. I want you to take me through the process. What happens on day 1, and how do you determine, whether they have enough bone, etc. The whole process, downtime, etc. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have oral surgeon, Dr. Burtner. Dr. Burtner, okay, the process. What happens on day 1? Somebody watching this, they're wearing a denture, they go in, what happens?
Randy, when the patient comes to me, I spend a lot of time with the patients on the initial visit. Even if the general dentist has already given the patient a lot of information, I come in and I just tell the patients.
So they meet with you?
Absolutely.
Are you always wearing a suit and tie?
No, I'm usually a little more casual in the office.
I know, we told you to wear a suit and tie today.
That's right. But, I come in and I tell the patient, listen, I'm going to tell you everything that I know about dental implants, and you stop me and you can tell me, okay, I already know that, Dr. Burtner, but
all right.
Very few patients do that. They want to hear the whole spiel. So I just start from ground zero, and I explain to them what a dental implant is. I explain to them that it's basically a screw that's made out of titanium, and it's going to be placed in the bone. And actually, when you have the implant placed, I explain to them that the first part of my procedure is placing the implant, and then you cover it up. When you put the implant in the bone, you put a little cover on top of it, and then you sew the tissue over the top. And normally they're going to wear a little trial temporary.
Then the bone just kind of holds on to that, or
well,
grabs
not
on it?
initially. When you initially place the implant in the bone, you're going to have just the mechanical forces stabilizing the implant. The other thing, Randy, and I tell patients all the time, I'm very conservative with implants. A lot of times, patients want to come in and I explain to them the only problem with the dental implants is, in most cases, it's not instant gratification. And unfortunately, that's what everybody wants.
All right.
But I explain to my patients, part of the success of the cases that I do is I'm very conservative. I don't push the edge of the envelope. I don't
know what
place
that means,
the implants.
very conservative.
Well, meaning that, I don't do a lot of immediate restorations with the implants, meaning you place the implant, the patient leaves your office, goes to their general dentist, and he puts the crown on top of it. Typically a temporary crown. But, there are certain indications where that can be done without any problems. I don't want to give the impression that, oh no, Dr. Burtner said that's not good, because that's not true. It's in some cases that is a good thing to do. But in most cases, I explain to people, listen, this is your money. Let's put it to good use. Let's place these implants. Let's do it very conservatively. Let's give it time to heal. And initially, like I was telling you, when you put the implant in the bone, the mechanical forces hold it. But over time, what happens is you actually get what's called integration with the implant and the bone. It's not a chemical integration. It's not a chemical bonding. It's actually a physical bonding, meaning that the bone cells actually lay bone down onto and into the porosities on the surface of the implant. Once the implant heals, meaning the implant has integrated with the bone, you cannot easily remove the implant, Randy, and that's why implants are.
It's like a tooth root, right?
Absolutely, but the only difference is with the tooth root, you can take the tooth root out. With a dental implant, you cannot unscrew this thing. It is actually locked in the bone, and it's not going to go anywhere other than some sort of catastrophic event, like a terrible infection or the implant just didn't heal properly.
What are the frequently asked questions you get on the consult? Are they the same ones you always get?
Well, yeah, most patients want to ask, what's the process, doc? How long is it going to take? What do I do? How many surgeries do I have to have? Is it going to hurt when I have the surgery? Those are all questions that they want to know the answer to. And so I spend a lot of time discussing those things. And I think I make the patients feel very comfortable with the dental implant process, because I do take a lot of time and explain the whole.
Are there misconceptions out there about dental implants that you hear? What are they? A
lot of misconceptions. Some of the patients that I see are diabetics. I had a lady come see me. She had been told for several years that she could not have dental implants, and she was a complete denture wearer, by the way, and could not have dental implants because she was diabetic. She was very upset about that, and for whatever reason, she found me. She wasn't referred to me by a general dentist. She found me.
Her ship finally came in.
Well, I guess. But she came to see me, and we sat down, we started talking, and she said, I've been told I can't have dental implants because I'm a diabetic. And I said, looking at you, do you have all your toes? She says, yes, absolutely. I said, how well controlled is your blood sugar? And she's very well controlled. She's been a diabetic for over 20 years, and she has had no amputations. She's had no other complications. She still has great vision. Those are all complications of diabetes. Patients that are well controlled typically are not going to have a lot of those problems.
What if they have osteoporosis?
Osteoporosis? No, I have a lot of patients that are in the age group where they have osteoporosis, and that does not eliminate them as a candidate for dental implants. But
so that shouldn't hold you back.
Should not.
Is it the happiest group of patients in dentistry? The denture wearer that gets some.
I would have to agree with that statement. That's probably very true. Patients that have been without teeth for a long time, and you give them that ability to have teeth that they don't have to worry about falling out while they're at a restaurant, or they don't have to take their teeth out and place them in a jar, Randy. I mean, that's something you and I can't relate to because we don't have that problem.
Interesting.
So when you get rid of those things for that patient, they're
you say they feel younger
away
when they get their teeth back.
Oh yeah, oh absolutely, because to most people wearing dentures means you're old, and nobody likes to feel old. You know, you talk to patients that are in their late 70s, early 80s, they're not going to tell you they're old. To them, they're still alive. They're just as
feeling good,
happy and doing the things that you and I do in a lot of cases, especially this day and time.
But what about somebody that says, I have bad gums? Dental implants won't stick for me.
That's not true, Randy. The reason these patients have bad gums is because they have just horrible oral hygiene. So the teeth are gone. You know, when you take the teeth out, they're gone. So the source for the infection is now gone.
So it goes away.
So typically the periodontal disease, the gum disease, the gingivitis goes away. That doesn't mean that you can't get these things with dental implants, but implants don't decay. They're not teeth from the standpoint that the bacteria are not going to be able to decalcify the dental implant. So you don't have that retention.
Like breath problems, things like that go away.
Yes, absolutely. Yes, in most cases they do, absolutely. Because you're getting rid of all of that decaying matter within the mouth, just like the name implies, decay. The tooth is actually decaying. It's breaking down, and that's where you're getting all of the halitosis, the bad breath, and things like that.
Final message, somebody watching this,
right?
They're missing a tooth, they're missing all their teeth. What do you say to them? And they're afraid, I guess, for whatever reason.
Well, a great place to start is with your general dentist. You know, talk with your general dentist. Discuss, you know, what your options are with dental implants. And most general dentists, like I said earlier, are very in tune to implants now. And they're going to be able to give you a wealth of information. And then, you know, tell the dentist, or if you don't have a dentist, you can actually come to me initially, or your implant specialist in general, and discuss what your options are. If you don't have a general dentist, we'll find one for you.
So know your options.
Know your options, absolutely. It's good to ask the right questions. And if the person doesn't want to spend any time with you and discuss that, then go elsewhere, because you're not always going to be given the correct answer, but that's why you need to look for more opinions.
So the future of dentistry, do you think someday everybody that loses a tooth will get a dental implant?
Well, I think yes, I do, for the time being, until we come up with something better, like implanting a tooth bud that actually grows a tooth. You know, that's where dentistry will head. And
we'll definitely have you back on the show when that happens.
Yeah, there we go. Then the oral surgeons will be placing tooth buds in the bone instead of dental implants.
Interesting, great. Well, thank you for coming on the show.
Yeah, thank you, Randy.
Very interesting, very good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, or direct a friend to this interview that's missing teeth, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.